Warm greetings from the High 10. It is Everyday Shenanigans on this Saturday, April 11, 2020, bringing you more said information pertaining to COVID-19. And if you need verification for this said information, please log on to The Hill. Experimental COVID-19 drug shows promise in new study. And there is a video in the link. An experimental treatment for the coronavirus showed promise in an early analysis of the drug as the world scrambles for a cure to the highly infectious virus. According to a report published in the New England Journal of Medicine, Gilead Sciences, Inc.'s experimental drug, Remdesivir, was able to effectively treat a number of patients in the U.S., Europe, and Canada who needed a respiratory support. The report tracked 53 patients, about half of whom needed mechanical ventilation, and 4 of whom were on heart-lung bypass machine. Of the 53 patients, 36 saw an improvement in oxygen support class. 25 people were discharged, while 7 died. Mortality was particularly high among those who were on a ventilator. The patients received the drug through Gilead's Compassionate Use Program, which is for critically ill patients who are unable to take part in a clinical trial. We recognize the limitations of these compassionate use data from a purely investigational perspective, while knowing they are of the greatest significance for the patients whose symptoms improve, says Gilead CEO Daniel O'Day. These early data from 53 patients have not been generated in a clinical trial and cover only a small portion of the critically ill patients who have been treated with remdesivir. A number of larger-scale trials are underway to study the effect of remdesivir has on COVID-19, the disease caused by the novel coronavirus. One trial conducted in China is expected to release results this month, while another from the U.S. National Institutes of Health could report results in the coming weeks. Now, there's a link in here that says French officials report heart incidents in experimental coronavirus. Coronavirus can travel up to 13 feet, and this is a study that was done. No treatments are available for the coronavirus, which has infected more than 1.6 million people worldwide and killed more than 100,000. Scientists are reportedly hopeful that remdesivir, a broad-spectrum antiviral, could be used to combat COVID-19. A World Health Organization panel said in January that the drug, which was developed initially for Ebola, was particularly promising based on human and animal studies. And that is the said information by The Hill. So, at the moment, this drug is being used through Compassionate Use Program, Gilead's Compassionate Use Program, for those who are very ill and not able to take part of the clinical trial. So I guess those are people who are immobile and on ventilators. And the name of this drug is called Remdesivir, Remdesivir, if you would like to look information up pertaining to this drug, how it came about, its uses. It has been used to treat Ebola. So we are hoping that it will work, because Ebola was a very detrimental, deadly disease as well, and it had spread worldwide. So let's hope and pray that this remdesivir helps us out to some capacity to help those here and abroad who are in need of medical attention. This is a serious disease, and as I have stated in my previous videos, a lot of you out there have not taken this disease very seriously. I know we all have taken a chance on contracting the disease by going outside, period, going to the store, going to get food, eating out, ordering out, being in the company of people. We really aren't serious about this disease because, frankly, we should not be in the company of others. Now, sadly, there are going to be people who don't drive. They need people to pick them up via Uber, Lyft, cab, or a personal friend or associate to drive them around. But that is the point of this virus. It does not matter who you are. It does not matter who you know, who you think you know. The virus is invisible, so therefore you are risking your life opening the door, talking to someone at the door, talking to someone at the sidewalk. a couple of feet from you. And now they say a study in here is showing this virus throws itself at 13 feet. So now that surpasses the recommended 6-7 feet of distance. What did I just tell you in the previous video earlier today? Every other day, there is a new study or recommendation about this virus, a different take, a new set of information, plural, pertaining to the virus. That's why I said if you're going to go 6-7 feet now to 13 feet, hell, you might as well not even go outside, period. Because I could go outside right now, there's nobody walking around. Who's to say someone did not sneeze or cough in the location that I bypass just to go to the trash, the mail, or to take a stroll? And I would like to walk today. It is sunny here in the high 10, a little bit cool, but pleasant. Beautiful day. But do I risk going out to walk? But then the flip side is, I've been outside how many times this week? Getting groceries, toiletries. It is never ending. So if I go out, I know I need to wear a mask, whether there's nobody out on the sidewalk or not. Just a precaution. That is the said information from the Hill. If you need verification for the storyline, please stay safe, America. Please take this disease very serious. Please limit your contact with people. Do not go visit anyone. Do not let anyone in your house. I don't care if it is your mother, your father, grown children who don't live with you, friends, associates, neighbors. Keep your distance. We are taking a chance by fraternizing with people, even if it's one or two people that we think we know. Because we don't know if we have the virus, and nor do we know if they have the virus. Because all people come in contact with somebody. And that's what I think a lot of you are not realizing. Is that no matter if you only came in contact with one person this week, they came in contact with one or two or three. And then that person came in contact with 3, 4, 5, 6, and so on and so on. God bless you, America. God bless those abroad. Like, share, subscribe. Drop your comments below. Thanks for joining me. I am grateful to be alive. Amen. And I'm praying for the safety of all Americans and all those around the world, children and pets. Wash your hands. Wear your mask and gloves when you go out. Keep your distance. Or better yet, don't go out at all. God bless you. Hope you stay safe. Amen. This is Everyday Shenanigans.